So without any further ado, I'm going to pass it on to Dr. Potva, who is going to present the findings of the knowledge synthesis. Thanks, Louise.
Thank you very much, Sume, for this introduction and for this opportunity to present this piece of work. Of course, you will see by the number of co-authors that this is a huge team undertaking, and I want to acknowledge those co-authors. Some of them are students in our program. I would also like to acknowledge that this research is and has been funded by CIHR. This is the plan for the presentation, and we'll pretty much stick to that. So without any further ado, let's talk about the social patterning of health outcomes. In Montreal, as in Toronto, I'm more familiar with the situation in Montreal, but there are huge disparities across neighborhood in terms of health experience as measured by a multiplicity of indicators, one of them being life expectancy. So as can be seen on this map, there's a 10-year gap between the neighborhoods or the areas in Montreal with the lowest socioeconomic status. That would be somewhere on the right-hand side of this map at 74.2 years of life expectancy, and this is in contrast with 84.0 at about in the area of Côte-Saint-Luc and this area of town, so where it's mostly affluent. So there is a social gradient of health, and this social gradient of health follows neighborhood. I'm sure some of you might have seen, the subway map of London, where you can see that at each stop you will end in a neighborhood with different life expectancy, and this follows, of course, the social deprivation in these neighborhoods. So there are two fundamental hypotheses to explain this spatial patterning of health. One is the compositional effect, and essentially it says that spatial differences in health are the result of the individual characteristics of residents in terms of demography, behavioral risk factors, and others. Essentially, it says those who look alike congregate and therefore share the same risks for their health. There is, however, increasingly, and for the past 20 years or so, work has been done on the contextual effect. So what is this place like that makes it healthy or not? And the main hypothesis underlying this contextual effect hypothesis is that places are socially constructed and pattern features that may or may not promote health through the possibility they provide. And someone like Sally McIntyre in Scotland has developed the term opportunity structure to talk about there are contextual ways in which neighborhoods are structured that are healthful or unhealthful. There is, however, and that's the work that we've been increasingly doing in Montreal, a hypothesis that would say, well, that it's not either or. Actually, it's the interaction of both. And through a theory of practice hypothesis, the context provides social and material resources, the life chance, that can be accessed and used to construct one's health. The quality of the housing, the quality of the food environment. Increasingly, there has been work in Canada about food desert, the food landscape, and everything that creates a neighborhood wherein you can see that you're not in another neighborhood. But these are not given by chance nor constructed haphazardly. It is, and this theory of practice would say that it is through their action, their life choices, that people reproduce and transform the context and the opportunity structures through which resources are accessible. Essentially, if there were nobody to buy a McDonald's hamburger that is located, the outlet is, when the outlet is located at the corner of a secondary school, of course, there wouldn't be a McDonald's outlet there because business wouldn't be good. So it is this interaction between people's practice and the resource that create the resource, and that in the same time enable their use for producing health. Let's do a little parenthesis about umbrella reviews. Most of you have not heard the term. So an umbrella review is essentially a review of reviews. So it is a very high-level synthetic under. The objective is really to try to see and have an appraisal of what is the synthetic knowledge and evidence that is out there and that can be used to address an issue. So the question that we were asking in this series of umbrella reviews that I'm reporting on today is, are local areas of action currently being addressed by intersectoral action the most relevant and effective for promoting health? Indeed, what we wanted to do was to give a rigorous update of the scientific knowledge about correlation, and we're talking about correlation at the neighborhood level between the food environment, community life, sustainable mobility, and material condition of the housing, and mental and physical health of population. And we wanted as well, with our knowledge users partner, develop a decision supporting tool and to help them orient interventions at the neighborhood level. Trying to get the arrow. Okay, so an umbrella review, as I said, is a rigorous and standardized bibliographic research and selection strategy. So our reviews are all about the general population. The phenomena of interest were correlations between the characteristics of the food environment, community life, material conditions of housing, and sustainable mobility and health. We narrowed our research in the context of urban neighborhood in OECD countries. We believe that the ways in which neighborhood affect or influence health is different in lower and middle income countries than it is in more developed countries. And the other criteria we used were reviews being published between 2008 and 2016. We did an update of that to include 2018. Available in English, French, and Spanish. We were able to synthesize in those three languages, and reviews with in which the search methodology was described in detail. So we did exclude program evaluation because this is an entirely different ways in which reviews are done, and analysis done at the individual level. We were in a Rosian perspective in which we wanted to see whether what is the knowledge and what is the evidence out there about the correlation between local context in terms of food environment, community life, housing, material condition of housing, and mobility, and health at the population level. So this is the dependent variable that we search for in terms of morbidity, health behavior, and perceived health status and well-being. So wait a sec. So for the food environment, this is the flow diagram that we started by finding more or less 4,000 citations, and through a series of filters, we identified 20 reviews that we analyzed. Now, umbrella reviews have a very interesting characteristics, is that, of course, no single review is just about the question that you're asking, and a lot of reviews then produce a lot of results that may or may not be all convergent. So we had to think about, and we worked with specialized people who are specialized in data presentation, really to be able to account for the heterogeneity of the results that we found. So we wanted to take into account the quality of the review. So we want to weight our conclusion by the quality of the review. So each review that was analyzed was given an AMSTAR score, which is a way to qualify, to assess the quality of a synthetic review. So we gave, in this presentation, we restrict to, we present results only about reviews of high and moderate quality. We had as well to take into account the heterogeneity in the results in terms of the population group. So we singled out results related to children and teenagers, adults, and the general population, and as well we had the elderly population for other umbrella reviews. And essentially we present our results in terms of the strength, the consistency of the association that were found in the reviews reviewed. So when the results were clearly favorable, meaning that great majorities of the primary studies that were reviewed in a review were all in the same direction and clearly favorable for health. They are in dark green. When they were not that all in that same, or when they were not all consistently significant, but some of them were not significant, so there was, we created this category in light green that was favorable trend. The same for unfavorable trend in orange. Clearly unfavorable were consistently the majority of the two-thirds, actually, our criteria was two-thirds of the correlations reported in the reviews were clearly in a negative association with health. And in gray, those associations that were inconsistent, meaning that a review reporting that primary studies were finding both negative and positive association being significant or not. So these were deemed inconsistent. So this is what we found in the literature. We found association with the four types of environment that we were looking for: food, environment, community, life, sustainable mobility, and material conditions of housing. And we found association with respiratory respiratory disease and asthma, cancer, physical activity, cardiovascular health, mental health, depression, healthy weight, injuries and traumas, healthy behavior, perceived health, and healthy eating. So this is, you will have in a snapshot the kind of where we did find correlation at the neighborhood level between those characteristics of the environment and these health outcomes.